Hi, I am Dr. Santhosh Kumar, practicing as consultant urologist, andrologist and renal transplant surgeon at Lux Hospital, Gachibowli, Hyderabad. Testes are the organs which are located in the scrotum in the males. So whenever you feel like a testis, there is a swelling or which is painless swelling which has noticed recently, there are chances that it can be a testicular cancer. Usually testicular cancer is most commonly noted in between the age group of 15 to 45 years of the age group. So these patients, whenever they notice a swelling in the scrotum or in the inguinal region which is painless, there are probable chances that it can be a testicular cancer, and these are the signs where you need to go to a doctor and approach to rule out what the swelling could be. So urinary bladder cancer is most commonly seen in male population. It can be seen even in female population also. It is most commonly seen in middle age group from usually 35 to 45 year to elderly, any age group. So usually when a patient is suspected or has to have bladder cancer, they usually present with irritative lower urinary tract symptoms like increased frequency or nocturia where the patient passes urine frequently in the night, or patient may have hematuria. Sometimes, most of the times it can be painless hematuria if it is a bladder cancer. So patients who have chronic smokers or who are working in dye industries, or some patients are neurological patients, usually they have chronic indwelling catheters, so that is called foreign body. These patients are most prone for bladder cancers. So whenever patient present with these symptoms, we rule out the cause, what is the inciting factor. So whenever a patient is diagnosed to have bladder tumor, based on CT scan, ultrasonography or other factors, then we advise him to go for histopathological examination of the tumor, where we remove the tumor by transresection of the bladder tumor. So after this, the patient can be managed conservatively. Few patients who have muscle invasive, where the tumor is very deep, they may need surgery to remove the bladder. The removal of the bladder can be done in various processes like open surgery, and it can be done laparoscopically, or it can be even done robotically. So it depends on the aggressive nature of the tumor. These patients will be managed, and few patients may need even chemotherapy and radiotherapy to control the tumor. The most common cause of renal swelling in children is nothing but PUJ obstruction, what we call as PUJ obstruction, that is pelvic ureteric junction obstruction, where the ureter transfers into the pelvis of the kidney. Usually most of these children are diagnosed nowadays in the antenatal scans only, and whenever the baby is diagnosed to have antenatal PUJO, post delivery the child will be followed, and depends on the aggressive nature, either it can be unilateral or bilateral, and if it is affecting the kidney, definitely he need to undergo pyeloplasty, which is a procedure which can be done minimally invasive or open surgery. So this PUJ obstruction can affect the kidney negatively, where the kidney function will come down, and if it is bilateral, there are chances it can be landed in acute kidney failure also. So these patients will need a definitive procedure called pyeloplasty, where we remove the abnormal ureter and connect it to the normal ureter.